So basically, when it comes to costocartilage injuries, costocartilage like is pretty much, well. First of all, this program doesn't necessarily show it as well as I'd like, but we have the cartilage here, and I'm going to just kind of shade it in.
Yeah.
This is our costocartilage, right?
Okay. Yeah,
Basically,
yeah.
where the rib now starts to meet the sternum, and it becomes cartilaginous, that area, and that's the area that typically pops, and you can kind of see like how it kind of differentiates itself in that area. So basically, what you did is you popped the rib, so to speak. You shifted, you adjusted it, and you more than likely irritated the costocartilage. Now, a lot of chiros, as your other chiros said in the past, or guys said in the back past, that if you adjust the back part of it, well, it would only make sense that since it wraps around. So since it wraps around, you're gonna want to kind of treat the kind of the structure, not just in the back side, but in the front side. That's also why I had you rotate, because I'm actually testing thoracic rotation too.
In the back. Okay.
So I'm seeing like, oh, this guy can't rotate to the right. Okay, is that due to the pain? Is that due to the limitations in this area? We can probably theorize that there's both going on, because if you can't rotate this way because of pain, well, then you're gonna just like not have that rotation in the back anyway, right? That's a protective mechanism.
Got it.
So basically, when somebody says, "Hey, I'm gonna put the rib back in place," I think that's like a poor example of like let's put the door back on the hinges. Like, it just doesn't work that way. In most places, like, it's not like you dislocated it, but what you did is you have a irritation to the costocartilage. Now, some people say if you kind of like pop it back in place, some people feel relief of that. In my opinion, I think that's just more of like just the release of the tissues and mobilization to the tissues and stuff like that. So I don't really think it's that area. Typically, what most people feel, you'll feel like nodules start to build up on there.
Yeah. And that's what, like, when I lay flat on the ground,
you can feel.
I'm like.
That's what I was feeling for.
Yeah.
So you'll feel those nodules. They'll go down with time.
Okay.
They will go down, but what gets them out is doing some soft tissue work to that area too.
Okay.
And I'll do some of that with you today. So, that's where like these little mini nodules will start coming up, and you'll feel like maybe almost like a triangular one there, and then a couple ones there, and a couple ones there, and it'll be and like maybe one up there, and then it'll be kind of like everything else feels pretty good. And so moving and mobilizing this area is pretty good. These cartilaginous areas are pretty fun to work. They can be a little tender, but let's add some of the musculature. So basically, when I tested you, I did rectus abdominis, which is like, the six-pack muscles, so to speak. But I also tested you doing oblique. Remember, I went like this. So like that type of movement, that was the one that hurt you the most. Shocker, look at where it attaches to. It's kind of like this spread.
Got it.
That does this, right?
Yeah.
But when I did hip flexion, look at where you had like some tension in the hips. Well, obviously you have to tighten the core, and you have to draw down when you're doing hip and core work. But look at where the abdominals kind of attach to, right at the pelvis. Right. So if you have the psoas or the hip flexor, which I'll show you all that as well, if you have the psoas or hip flexor kind of having an issue and bearing down and tensioning this area, you're also going to have the core as well as like other internal and external oblique. Here's the internal oblique muscle, so you can kind of see how it attaches. That's the rectus abdominis. You were actually pretty clean on that one, so I'm not even going to talk to you about that. Transverse abdominis, we'll talk about that, I guess. But you can kind of see why, like, I think in your case, like, why you also see a little bit of oblique, like, because that's this one where you did this one. Wasn't too bad for you, but sometimes a lot of people have internal oblique issues as well. But I think that you had more of an issue with the external obliques, the ones that kind of run, the fiber directions run this direction. They also have more of a spread on the ribs.
Okay, so it's kind of like a sheet or whatever. Okay.
So like that's when you do these ones.
Yeah.
So
and that's the way I was when it happened too. That's kind of the direction I was. Legs, hips, everything were this way.
Yeah.
And I was turned back this way, and then when I pushed and came this, it just
felt the pop.
Yeah.
So really like, and this is one of the reasons why we worked the hip flexor too, because you were literally bearing down. So we have to find out what the MOI or mechanism of injury is, and then understand like, okay, what the hell was happening at that point in time when you popped it, and then pretty much do the opposite of it, right? Just stretch it out essentially. But then rehabilitate it. So typically those nodules, and people freak out a little bit about this. Not a lot of people, but most people. It's just literally the soft tissue rescarring, rescaffolding.
Okay.
So just like kind of doing housework on a roof, you kind of would have to build a scaffolding.
Yeah.
Fill that scaffolding, and it might look like crap, and then it usually kind of irons it out.
Got it.
Cartilaginous
Okay.
stuff is not really the prettiest looking though.
Oh, yeah.
But
it's okay.
But basically, your nodules seem like it was like right over that, right at the cusp of that internal oblique, which is why I don't think you have as much of an internal oblique issue as the other.
Cool.
So I think that was it. So in terms of thoracic rotation, we talked about that.
Mm-hmm.
You're just not able to essentially rotate around that axis as well because of the irritation, and that will come back with time. I'm not really worried about that.
Good.
So basically, I mean, you don't have any tenderness right here at like the attachment point, right?
No, right here and all was fine, and that's where it happened the first time. It was up here in this area years ago, but yeah, this one was down further. Yeah, like I said, it was tough for the first few days, but now it's just kind of like slowly the tenderness is going down. But again, I just want to make sure like it's on the right path. I didn't know how long it was gonna hang out.
Good question. I think like the number one thing there's I call it check marks or benchmarks, just like I don't know if you're in IT, and I'm gonna butcher this, but if I don't know how to turn on a computer, like first step is turn on the computer. Like you can't run an app or a program if you don't know how to turn on the damn thing. Like for you, it's like if you want to get back, you need to be able to take deep breaths without having a strain in there first. Like so, deep diaphragmatic breathing. You need to be able to have the rotational aspects of it, and you need to be able to get that dialed in. So when I say here's the timeline, I think that's where like you can have like an IT issue, and like once you start digging out, you're like, oh, this will take like 3 hours, and you're like, it's like 5 days.
Right, and you hit.
And then you hit like a wall.
Yeah.
So like, if I tell you a timeline, I think that's the wrong way. I think what we should do is look for benchmarks and checklists. Like, can you take a deep breath? Do you notice that like walking out of bed is better? That 15 seconds doesn't now come on until 20 seconds. You know, things like that. Is that consistent? I do find that heat works better.
Heat more so than ice.
Yeah, I do find that heat because like the ribs, if we add like the nerve, artery, and veins and stuff like that, they do wrap around this area, but like they seem to not get as much cartilaginous blood flow in that area. So if you can kind of like
heat
a little bit of heat pack right here, 10 minutes on there, 5 minutes. It's not the most comfortable place to heat it on, but it really soothes the injury pretty good. And then I'll show you some things you can do. There are some things in here also that I did not mention. There are intercostal muscles. So muscles that essentially hold rib to rib to rib, right? So those typically get intercostal, right? In between. So they go in between, and we'll have to work some of those out a little bit too.
Because that is something like I can feel. I put my fingers down in there, and I can feel like, oh yeah, those 3 or those few spots.
There's usually about 3 or 4 segments. It's never just one. A lot of people will try to like wrap around and kind of do that. Probably tried once or twice.
Yeah, and then I'm like, oh, and then I just imagine like pulling the rib and just cry.
Yeah, not. But other than that, I mean, pretty good strength. There's nothing that's like super deficient. On you, you're not like, oh my god, this is not terrible. I don't think it's broken. Like you wouldn't have kind of survived my test, so to speak, of me kind of like pressing like this and kind of changing the angles on you. You would not have like that at all. I am not a big fan of face down adjustments when we do them, because I find that when let's just put this person on this direction. Can't do it. Guess you can't do it. But imagine you going this direction. I just personally do not like a force going from backwards to forwards, and then having the counter forces going back onto the ribs that direction. I find that that's actually very, very harmful to people. So if we do adjust your ribs or back, we'll be doing it face up. for
it.
today. So
Got
pretty
it.
much 90% of the work is going to be face up today.
Cool.
I treat this in a lot of different ways in terms of like Graston or ART, if you've ever heard of that.
I looked it up. I
yeah.
was looking up. I'm like, oh, what are those certs behind his name? I'm like,
Yeah.
active release.
Yeah, so
Yeah.
basically it's
Yeah.
specialized soft tissue work that
Yeah.
we're going to work all the way through here and kind of work
Cool.
this stuff out.